KER-050 is a recombinant fusion protein. It binds to the TGF-beta signaling pathway, and it inhibits SMAD2 and 3 signaling. This in turn promotes the maturation and differentiation of erythroblasts as well as megakaryocytes in the marrow. So there was a phase 1 study that was conducted that showed that KER-050 resulted in a rapid and sustained increase in reticulocyte followed by increase in hemoglobin in healthy volunteers. We also observed a clinically relevant increase in platelet count in those individuals. So what we have presented at the recent EHA meeting was the preliminary data on a phase 2 study, which is ongoing at present, evaluating the safety and tolerability of KER-050 in patients with lower risk MDS. The study enrolled patients with lower risk MDS as defined by the IPSS-R, so very low, and intermediate risk, as well as patients who are anemic with hemoglobin less than 10 grams per litre, or patients who require red blood cell transfusions. The important thing to note is that we did include patients with both ring sideroblasts as well as non-ring sideroblasts into the study. As of the data cutoff, we have 31 patients who has been enrolled to a study with 27 patients who are evaluable. The results available to date showed that it's very well tolerated at all dose escalating levels, and there were no dose limiting toxicity that was reported, and no patients had progressed to AML. In terms of the efficacy of the 27 patients who were evaluable, we did see a good response with 51.8% of patients achieving an overall erythroid response. And if we were to focus on patients with high transfusion burden, the overall erythroid response was 68.8%. We also saw a meaningful reduction in transfusion in both ring sideroblasts as well as non-ring sideroblasts patients, with an overall of 45% of patients achieving some reduction in the transfusion burden. And if we were to look at the high transfusion burden patients again, 43.8% of patients achieved transfusion independence. The most frequent treatment emergent adverse events were generally low grade, and they were fatigue, anemia, nausea, diarrhea, and headache. The other point about efficacy is that we also saw an increase in platelet count in patients with high transfusion burden who has achieved an erythroid response. So all in all, what we've seen is that KER-050 is very well tolerated, and we've seen very promising erythroid response, both in ring sideroblasts as well as non-ring sideroblasts patients. The improvement in platelet count suggests that KER-050 acts more broadly on hematopoiesis, potentially valuable treatment options for patients with multilineage dysplasia and cytopenias. So the phase 2 part of the study is currently ongoing, and it has moved to the dose confirmation cohorts.